Hi, my name is Donald Stater. I'm a senior pain management and opioid policy advisor with the Colorado Hospital Association. I'm also an emergency physician who practices at Swedish Medical Center. Today, Colorado Hospital Association is proud to present our series on procedures that you can use in the emergency department to reduce pain and also reduce opioid usage. In this video, we're going to talk about trigger point injections of the torso and lower back. When a patient comes in and they have either torso or back pain, which is made worse by palpation, and you can feel that one spot that makes the patient jump, this is a great treatment modality. And also, it makes sense to patients. We're going to numb up right where you hurt. And when you combine a trigger point injection with a little bit of dry needling, there is nothing more effective for the control of this type of pain. So to learn about trigger point injections of the torso and lower back, we're going to meet Matt. Matt actually hurt his back and his shoulders while weightlifting a few days ago. Now, Matt, when I push there, does that hurt a lot?
No, not really.
How about when I push here?
Yeah.
Yeah, okay, so that's the spot. So one, we've identified a trigger point on Matt, and he has a positive jump sign, meaning that he'll flinch when we actually get to the area that hurts. Now in your lower back, Matt, how about right there? Does that hurt?
Yeah, a little bit.
Okay, how about here?
A lot more.
A lot more, okay, great. So we've at least found two places on Matt which are great candidates for trigger point injections. So let's grab the items you'll need to perform the procedure. Bupivacaine 0.25% or lidocaine 1 to 2%, a 10 milliliter syringe, an 18 gauge needle to drop medications, a 1.5 inch 27 gauge needle, an alcohol pad or ChloraPrep, and a pair of gloves. The risk of trigger point injections to the torso or back are minimal if done correctly. They include allergy to the medication, localized skin reaction or infection, and if you're doing it on the torso where the lung is, possible pneumothorax if done incorrectly. But in this video, we're going to show you how to do it correctly so there's almost zero risk of puncturing the lung. Either written or verbal consent should be obtained from the patient prior to performing the procedure. So to perform these trigger point injections, you can either do it with the patient standing or laying down. And my great preference is for the patient to be laying down. So Matt, go ahead and lay on your belly, okay? With your head up by the pillow. Okay. So Matt, there's a few places that are very common areas to hurt on the torso and back. And let's do the lower lumbar area first because this is the safer area to inject. Now, a very common area is where all these back muscles insert right into the SI joint. So do you hurt right there?
Yeah.
Yes, okay, so that's a great area, and that's one of the most common. Now, oftentimes you'll find patients have multiple areas that they are painful in. And it's okay to inject 4 or 5 areas, sometimes using up to 20 milliliters of bupivacaine on a sore muscle back here. Right now we know that Matt hurts right in this area. So we're going to go ahead and clean the skin. And Matt, you're going to feel a little poke here. And then afterwards, you'll feel just me moving the needle a little bit. So what we'll do is we'll actually put our needle into that area. On 3, 1, 2, 3, poke. And now we'll start injecting. And while we inject, we actually fan the needle back and forth across this entire area. Because what we're doing is not only injecting into the muscle, we're needling the muscle, and needling of the muscle has also been shown to have good benefit in terms of patients' pain. Now for each trigger point that I inject, I'll inject around 3 or 4 cc's of fluid. And we can do, like I said, multiple across the lower back or gluteal area, depending on the points where the patient hurts. We've done a trigger point injection down here, but let's say that Matt actually had pain in this muscle up here when we palpated. Now, oftentimes when I do injections, kind of in the mid-thoracic, the upper lumbar or lower thoracic spine, I make a point to actually inject downward with the needle into the musculature. Okay? So we inject down so you don't inadvertently go up and touch the base of the lung and accidentally cause a pneumothorax. Now, if Matt has pain right here, kind of on the torso, but where the lung is, then you never inject perpendicular, because that would increase our risk of a pneumothorax. What we do for this muscle is we actually pinch the muscle up. And to help you do that, oftentimes we'll have patients put their arms at their side, because this now relaxes this muscle group. And what you do is you'd clean, you'd give a really good pinch, and then you'd put your needle in like this. That way, you're not inadvertently going too deep. And it's nice when patients are laying down because they're not going to flinch backwards and inadvertently have the needle go somewhere where you don't want it to go. Now, Matt doesn't have pain in any of these areas. He has pain up here in his trapezius muscle. Now, Matt, do you hurt when I push there?
Mm-hmm.
How about right there?
Yeah.
Yeah, that's the area. So we know Matt needs a trigger point injection right there. And again, what we do is we'd clean the skin. We would not inject parallel to where the lung is, but we'd basically give a lot of pressure and make that muscle come up to us. And then we'd inject parallel. So on 3, Matt, 1, 2, 3, poke. And then we'd start injecting, and again, we're going to needle back and forth in that muscle. I know I'm not going too deep because I've got the muscle that we're injecting in between, and we're going to inject again another 3 to 4 cc's in this area, and then pull out. So after we perform these trigger point injections, most patients will start experiencing relief within the first 5 to 10 minutes. As you can see, trigger point injections of the torso and lower back are easy to perform, and when combined with Tylenol, NSAIDs, and muscle relaxers, can be an extremely effective way to treat musculoskeletal pain in these areas. You can learn more about the Colorado Alto product at www.cha.com/alto. Finally, on behalf of the Colorado Hospital Association, thank you for the care that you provide our patients.